Hello, welcome to my video in which I will be talking about the relation between COVID-19 and the nutrient zinc, which is a mineral. Alright, so the research question that we'll be studying throughout this presentation is, do zinc levels present in the body affect outcomes of COVID-19 infection? So to start off, zinc is a mineral that is essential for the body and is essential to get in your diet as it is involved in the body's immune system responses and maintenance and has, in general, antiviral functioning. It's found in foods such as seafood, meats, legumes, and other foods as well. So essentially the way that zinc works in this terms of the cellular processes for its immune functioning, it includes the inhibition of RNA synthesis, viral replication, and other viral proteases. And this has been demonstrated through zinc's effectiveness at combating certain RNA viruses, including the common cold and influenza. And in relation to the common cold, zinc supplementation given early on before contracting the cold has the potential to reduce the duration of the cold. And zinc is also related to T cell and B cell functioning, which is involved heavily in immune system responses as well as viral functioning, and therefore could have a relation to COVID-19. So in terms of the two combined, there is a suggested mechanism between COVID-19 and zinc, and this is through the receptor ACE2. So due to the antiviral and immune functioning of zinc, zinc could definitely have a relation to COVID-19 and lessening the outcomes from infection of the coronavirus. So in terms of the specific cellular mechanism, this hydrolase ACE2 receptor is involved. So ACE, just as a background, ACE2 is a zinc-dependent hydrolase, which will allow for the uptake of a virus into the cell, leading to infection. However, when it is bound to zinc, it results in decreased ACE2 expression, which results in reduced viral infection. So essentially, when zinc is present has levels present in the body, the virus will have a harder time being uptaken into the cell, as the zinc is inhibiting ACE2 functioning. So when ACE2 is not bound to zinc, due to low levels of zinc present in the body, ACE2 interacts with COVID-19, which then leads to this uptake and further infection. And this will lead to further expression of COVID-19 and increased viral effects of the virus. And this relation between zinc and COVID-19 has also been shown in a study done in India, where they demonstrated the correlation between worse outcomes from COVID-19 infection and zinc deficiency. So they had a group of patients who had COVID-19 and patients who didn't, and basically patients with COVID-19 had significantly lower zinc levels in comparison to healthy controls, of which were people who didn't have COVID-19. And specifically within the patients who had the COVID-19, 57.4% of those people were zinc deficient, and these patients had worse reactions to the virus, including more complications and worse outcomes, some of which included developing acute respiratory distress syndrome, hypotension, longer hospital stays, and an increased mortality rate. And this clearly demonstrated a link between COVID-19 and zinc, even though they had no specific cellular mechanism behind this or specific besides the correlation. However, as we saw here, there definitely can be a relation between COVID-19 and zinc due to this receptor ACE2, and this study further demonstrated how there definitely could be a relation between these two. And in general, during this time of the coronavirus, maintaining good nutrition is highly recommended, as as increased zinc levels can aid in preventing worse outcomes from coronavirus, as demonstrated from studies, and through zinc's overall immune system and antiviral and anti-inflammatory properties and functioning. And also, the other nutrients are also involved in this, in potentially combating the coronavirus infection, and zinc is definitely a nutrient that, with maintaining good nutrition, will be the body will be able to uptake and absorb enough zinc to then be able to combat viruses such as coronavirus, the influenza, and the common cold. And in general, to combat viral RNA infections, it's shown that supplementing nutrition, like nutrient supplementation administered before contracting the virus, helps with decreasing the duration of the said virus, of time with the said virus. And this could definitely be applied to COVID-19, but it has to be shown in further studies and with respect to maintaining proper zinc levels in the body and in terms of other nutrients as well. And here are my references, and thanks so much for watching. Have a good day.